Fetal circulation and changes at birth. As an introduction, fetal circulation delivers oxygen and nutrients from the mother to the baby through the placenta, bypassing the lungs and liver, which are not quite functional yet. Blood flows through the umbilical cord for exchange, with waste products being returned back to the mother. Transition to neonatal circulation. At birth, the placental exchange ends, shunts close, and the lungs assume oxygenation. That's when the baby takes their first breath. This rapid cardiovascular changes are critical, especially for preterm and compromised infants, making prompt recognition and management essential. Key differences between adult circulation and newborn circulation. The placenta is the oxygen source. Fetus relies on the placenta for oxygen and nutrients via the umbilical cord versus the lungs, bypassing the lungs and liver. Shunt bypasses non-functional lungs and partially bypass the liver. Unique shunts. Ductus arteriosus connects pulmonary artery to aorta, diverting blood from lungs. Ductus venosus directs oxygenated blood from the umbilical vein to inferior vena cava, bypassing liver. Foramen ovale allows blood to flow from right to left atrium, bypassing right ventricle and lungs. Increased pulmonary resistance. Unexpanded lungs cause high resistance, requiring shunts. Unique blood flow pattern. Oxygenated blood travels from the placenta via the umbilical vein through the liver into the inferior vena cava, then bypasses the lungs via the foramen ovale and ductus arteriosus to synthetic circulation. Detailed pathway of fetal circulation. Oxygenated blood from the placenta enters the fetus via the umbilical vein, carrying oxygen and nutrients. Ductus venosus, about half bypasses the liver to the inferior vena cava. Rest perfuses liver before draining into the IVC. The IVC delivers mixed blood to right atrium. The Eustachian valve directs oxygen-rich flow through the foramen ovale to the left atrium, then the left ventricle, then the ascending aorta, supplying brain and heart. Deoxygenated blood in the right atrium flows to the right ventricle, then to the pulmonary artery. Only about 10% goes to the lung due to the high resistance. 90% is shunted via ductus arteriosus to descending aorta, supplying the lower body and returning back to the placenta via umbilical arteries for reoxygenation. Physiological significance of the shunts. Ductus venosus regulates blood from the umbilical vein and bypasses the liver, preventing heart overload. The foramen ovale directs oxygen-rich blood to the systemic circulation, especially the brain and heart. Ductus arteriosus diverts blood from high-resistant lungs, maintaining systemic flow. Changes at birth and transition to newborn circulation. When the cord is clamped, that stops the placenta blood flow and oxygen supply from the mother to the baby. The first breaths inflate the lungs and lower that pulmonary resistance. Pressure shift. Left atrial pressure rises. Right falls, closing foramen ovale. Ductus arteriosus constricts with oxygen rise and lower prostaglandins, closing in days up to weeks. Ductus venosus closes, directing blood through the liver. The result occurs when the blood is oxygenated now by the lungs and the processed liver, forming adult circulation. So a lot happens in a short amount of time when that baby. Clinical importance. Timely closure of the shunts is vital for proper neonatal adaptation. Persistent shunts, like a PDA, a PFO, they may cause circulatory issues needing additional medical care. Fetal circulation supports survival in utero for some congenital heart defects until the baby comes out, especially if you're taking care of a population that doesn't do a lot of ultrasounds or they did an ultrasound and it got missed. Your baby may be fine, and then if there's a congenital heart defect, the kid cannot support itself when that circulatory transition occurs. Fetal circulation, that circulatory process is designed to ensure efficient oxygen and nutrition delivery and preparing the baby for that transition to birth. There's key fetal shunts and changes that occur before and after at birth. So thinking of the three core structures we've talked about, ductus venosus, before birth, it bypasses liver for oxygen-rich blood, and then at delivery time, closes as the umbilical flow stops. Foramen ovale shunts blood from the right to left atrium. It closes with increased left atrial pressure. The ductus arteriosus bypasses the lungs to the aorta, and then at birth, it closes to that high oxygen prostaglandin drop. As an overall conclusion, transition from fetal to newborn circulation is a precise process vital for survival outside the womb. It requires shunt closure, lung aeration, and cardiovascular adjustments to ensure well oxygenation delivery and organ transfusion and perfusion. Understanding these changes is key to managing all babies, but in particularly preterm and compromised infants. Advances in monitoring and cord management have improved outcomes with ongoing research refining the care during this critical process. And that's a lot of when you do the newborn resuscitation program. The training is about that circulatory process and how do we support the babies going from inside their mothers to the outside world on their own.